I put it out on Facebook thinking, I know I can't be the only one that got sick from this. I know that another person in my same graduating class was sick in the 7th grade when I was sick, and he died and I lived. So there's 2 people in one class. Who else got sick? So I put it out to just my 400 friends on Facebook, and not even all those people get messages when you send one out. I had 23 responses in 2 days of people under 40 who went through the same school system in the same 5-year period that had some kind of cancer, and that's not counting the breast cancers or the ones that may not be looked at as environmental exposures. That was brain, liver, kidney, lymphoma, one that I can't remember the name of, and I don't know what type because it was so rare. And some of those people were dead. You know, I was just getting reports in from classmates that remembered, oh yeah, do you remember so-and-so? They got sick. So I think in a small country community, to find 23 people responding in 2 days that just got my messages out of that group, I think we've got something here.
Through our research, we sent out 30,000 not flyers, questionnaires, surveys to independent zip codes, independent zip codes, and we tried to first target the first radius around Fort Detrick within a mile. Then we expanded that. And out of the 30,000, about 15,000 came back. And out of the 15,000 that came back, it was almost 1,200 people that were suffering from cancer within a 1 to 2 mile radius. And Angie has some of the statistics, but like one road had 60 homes that had cancer on one road.
We have 22 with cancer off of Kemp Lane, 42 people with cancer off of Rocky Springs, 60 on Shookstown Road. And initially what happened was, before we even did like scientific studies, you know, just in February of 2010, when my mom was initially diagnosed and we found out about the MPL, I did, you know, like an amateur survey off of Facebook. And that's when, you know, I had a lot of young people that were my sister's age or my age that lived within a mile of me and Fort Detrick, and they had non-Hodgkin's lymphomas, leukemias. One of my really good friends, her name is Emily Rhodes, and they speak with us through our foundation, so I know they don't mind if I use their name, but they were a quarter of a mile away from me, and out of their home, the dad had, you know, an aggressive stage 4 cancer, and also his daughter at the same time, similar to my, you know. And that's when we started, you know, red flags went up.
At the time, the Kristen Renee Foundation was releasing to the media a lot of information about their surveying of individuals and the number of people who had reported to them. And what we talked about in the technical advisory committee was, how can we make best use of that data? Because for their data source, so they weren't using the Maryland Cancer Registry, they were surveying people who live there currently, people who maybe lived in a mile, people who lived 10 miles, people who lived there 40 years ago, and who self-reported particular type of cancer. One of the challenges is that you don't know the denominator. So you might have a total number of people, if you say, well, there were 1,200 people with cancer. Well, it depends what the denominator was, because in just a 1 mile radius in the initial time period that we did the cancer cluster analysis with the data, well, in a 1 mile area, in just, I believe that, now I have to check my numbers, but it was 5 years, 6 years, there were over 1,000 cases there in just that short time period. So if we're talking about collecting cancer information from people spanning 40 years, you'd expect in this area that there would be more than just 1,000 cases, because we know from that shorter time period, from just using the Maryland Cancer Registry data, that there were that many cases. So anyway, so that's one of the challenges, is trying to make good use of the data that and to be able to understand the rate.
Sometimes a reporter will collect information and go around, and this can be a good thing in terms of raising awareness, but it can be, unfortunately, when it's not validated, it can be a misleading thing, where you have these anecdotal reports. People will say, oh yes, we remember before we moved in, there were 3 people who lived in this apartment who had a cancer, and we can't confirm that. Now, that doesn't make the report go away, but you really can't include that in the analysis. So it's important to show the difference. And we've actually done some work on that where we plotted out reported cases versus things that we validated. There's an overlap. And a lot of things that communities do to bring things to attention are, in fact, important and really provide the foundation of an investigation. But you also have to understand is, just think of it, you really don't know too much about the causes of death of someone that may be a distant neighbor or somebody who lived there before. You might hear about it. And so it's worth bringing it up. But unless it can be validated by medical records, unfortunately it's very hard to use that in the calculations, in the determination of statistical significance. But suppose you have a person who says, no, my uncle had a brain tumor and he's not in the registry. How do you track that down? So in this case that I was investigating, we found there were all kinds of other things that were kind of misinterpreted as brain tumors. For instance, lots of people who have a cancer, say, of the prostate or of the lung, have what's called metastasis and spread of the cancer. So you have a heavy, my father died of cancer. It's part of my motivation to get into this field. He was historically a heavy smoker, and he had exposures in the war and things like that. And unfortunately, he died of lung cancer. Before he died, that cancer metastasized or spread to his brain. All right. So I remember my mother being really upset, saying, it's in his brain now. It's in Daddy's brain. Well, is that a brain cancer? No, it's not. Epidemiologically, it's not. It's a spread of another kind of cancer. So a disease detective, an epidemiologist, has to really track these things down. And if your quest is to find out how many cases of brain cancer there are, you need detailed medical records to get an accurate count. And so the anecdotal information would be a start, but you might find, oh, somebody had a benign growth in their inner ear that somebody's family member thought was a tumor. Or someone may have had a much more common cancer that spread to the brain. And all of these things are part of the way that we validate the records and really get the true counts. It's very challenging. And you might imagine, as I described this, incredibly labor-intensive and expensive. So I think it's important to have a preliminary look to see, is it really going to yield any results if we do this detailed analysis? And sometimes you have to say, you know, the numbers are too small. We don't have an adequate sized community, and it's very unlikely we will find anything. Let's look at exposures. Let's look at other ways we can address community concerns.
Well, again, I think it has to be taken seriously, but the public health investigator should do whatever is possible to validate or not validate the individual records, and should make clear to the public what is going on and why there may be serious difficulties with the data. There was a sort of a community survey in the Frederick area in which there were efforts to collect information about cancer histories tied to location. And it turned out to be very difficult, and the results were demonstrably not reliable. Check those cancer histories against the cancer register for the county or in other ways, and using the history of that kind of thing where personal histories like that are often presented. You can find all kinds of difficulties, things reported, diseases reported as cancer that aren't cancer. A lot of suspicion, well, I think he had cancer, but no medical diagnosis or backup to validate that. People get wrong about residence histories. They're wrong about timing of things. I'm not saying they don't do their best. They do, but it's just not a very good way to collect information. Now, again, I'm not saying there aren't any clusters. I'm quite convinced there are. The question is, how do you identify those? The real ones, the ones that have a specific cause.